Hello, and welcome to this training on Cambridge HMIS privacy and security. My name is Marianne Colangelo. I work for the Planning and Development Office in the City of Cambridge. Let's have a look at our agenda. First, we'll have an overview of our training goals, then a definition of common terms, just a few fundamentals of privacy and security, a little bit about HMIS governance, the three documents that are crucial to this subject will be discussed: the three-step privacy process about collecting client consent, client rights, special considerations, and then we'll review some of the key points covered in this training. Before we go any further, these items listed here are required reading for this training. There will be a quiz, and it would be ideal if you could print these forms and have them available to read either before or after you watch this training, or even during, if that's helpful. Okay, let's look at our training goals. A bit about what we refer to when we're talking about an end user. If you're watching this, you're someone considered to be an end user. That is, you either use or will use HMIS by logging into Clarity and recording your work, or you work in a role at your agency where you collect HMIS data as part of the one-on-one work that you do with clients, but someone else at your agency will enter that data into Clarity. Either way, you're an end user. So the goals that we have are: ensure that you understand what HMIS is and its purpose, ensure that you understand privacy rules related to collection, management, and reporting of client data, ensure that you have understanding of the release of information process with your clients. That is, obtaining the informed consent from them, the documents that go along with that procedure, and knowing data collection versus data sharing in this context. Okay, a little bit about some common terms that have acronyms that we refer to often. The COC is the continuum of care, and you can see we have listed here they are the planning body charged with guiding the local response to homelessness. In the context of what we're talking about now, it's important to know that they are responsible for overseeing the HMIS lead agency in our operation of HMIS. HMIS stands for Homeless Management Information System, and that's the system that meets HUD's requirements and is used to measure homelessness and the effectiveness of related service delivery systems. So HMIS is the primary reporting tool for all of the HUD-funded projects and grants, as well as for other public streams of funding related to homelessness. Clarity, not an acronym, but Clarity we refer to often. That's our HMIS software, and the vendor for Clarity Human Services is BitFocus. A little bit more about Cambridge HMIS, but maybe the most important on this slide is the definition of PII. PII, personally identifying information, is a category of sensitive information that is associated with an individual. It should be accessed only on a strict need-to-know basis and handled and stored with care. More about PII right here. Okay, sometimes you'll also see PPI, personally protected information, in this context, and HUD refers to them interchangeably. So I've put the quote from HUD's HMIS data and technical standards document here because it's important to be more specific about what PII is. You can see here that PII is listed as any information maintained by or for a covered homeless organization about a living homeless client or a homeless individual that, one, identifies either directly or indirectly a specific individual, two, can be manipulated by a reasonably foreseeable method to identify a specific individual, or 3 can be linked with other available information to identify a specific individual. The obvious examples of PII are first and last name, date of birth, and social security number. What data are collected? We're not going to go over the HMIS data elements in this training, but for people who are new to this, that besides PII, there are other data elements that we are required to ask you to collect, and it's all in this one manual, and we'll cover that in another training. Why is HMIS important? Well, it's mandated by HUD. The reason it's mandated is in part because we need to use it to aggregate data to inform our report on the longitudinal systems analysis, also known as the LSA. That makes up the annual homeless assessment report, also known as the AHAR, which might be more familiar sounding to you. This is the report that gets a lot of press every year about the same time, usually around December, because it's about the state of homelessness across America. It's what HUD gives to Congress, and then the findings get looked at from state to state across the country in different geographic ranges. And the information that you enter into HMIS is informing this data for the city of Cambridge. Other reasons why HMIS is important, other reporting reasons. COCs must use HMIS in part of our annual Notice of Funding Availability competition. COCs must use HMIS to report on system performance measures, very important, and using HMIS informs policy and funding priorities. Also, for your own agencies, HMIS gives you data on your clients that you can use for aggregate reporting to show to funders and potential funders. So I added this slide from HUD because I think it gives some good context for why the day-to-day client level data entry in HMIS is so important and why sharing in our system is important. As you can see, there's a lot of evolving from the types of activities on the left and approaches that you see on the left that are really focused more locally with regard to an agency or a project and an old way of doing things. And then over to more thoughtful, comprehensive, holistic ways of looking at data and using data to inform our decisions and show what kind of job we and other communities are doing in order to help end homelessness. So I hope this is helpful for you. Next up, fundamentals. Okay, what about data privacy and security? Collecting and sharing participants' personal information is often necessary, right? It's mandated by HUD, and it's often really important in terms of really being able to help resolve someone's housing crisis. It's important for COCs and providers to make informed policies and procedures and fully understand the following. So, we need to all understand how data are collected, used, and stored and disclosed across our own system, meaning our Cambridge HMIS. We need to understand our responsibility to protect client information that's stored in HMIS, also able to articulate those responsibilities to our clients in a meaningful way. Okay, some basic definitions that are important to this topic: data privacy and data security. So data privacy is the legal requirements and information practices that regulate the collection, storage, and use of personal information. Data privacy measures ensure that a person whose information is being used and disclosed by another party is informed and has choice in how their information is used. Data security is the protection of PII from unauthorized access, disclosure, use, or modification. You play a role in both of these. Why are privacy and security important for HMIS? Well, because HUD's mandate to have communities use HMIS requires collecting, storing, and handling PII. And I took this quote from the HMIS Data and Technical Standards, which says that we are aiming to protect confidentiality while allowing for reasonable, responsible, and limited uses and disclosures of data. So we're essentially saying we need to collect this information. It's private. We need to protect it, but we also need to have a reasonable way of knowing when and how to most securely share it when we need to. All of this is outlined more thoroughly in our Cambridge COC HMIS Policies and Procedures Manual. Data collection versus data sharing, a very important distinction. Data collection in HMIS is required by HUD and important to the COC. This is the collection of HMIS data elements through agency staff interviewing the client, usually at the start of when they receive services from you and your agency, and entering it into Clarity. In turn, this data is stored and viewable only by staff at your agency. So that's the collection piece, right? You could be collecting this data, some of you on paper before it goes into Clarity, and that's your data collection piece. No one else at another agency has access to it at that time. Data sharing in HMIS pertains to an agency adding data to Clarity for their client and, if needed, other agencies having the ability to view some of that data. So, for obvious reasons, coordinating services, being able to document episodes of homelessness, etc. So, presently, at this time of recording, most agencies using Clarity share client profile data by default. What's on the client profile page? It's PII, and you will see a screenshot of it shortly. Here's a visual about data collection versus data sharing. You can see on the left, we're talking on this whole diagram about one particular client, Nestle Toll House. And you can see the example of Nestle Toll House getting services at agency A and also at agency B. And those two occurrences are separate in HMIS, which means that we would have two different records, duplicate records for Nestle Toll House, duplicate PII, same date of birth, social security, etc. But then attached to each record would be different enrollments with different projects. The data sharing part is what's much better. It's one record and both agencies users can access that one record and view their own data, do more data entry when they need to, update client records, and also see information, depending on the sharing level, about their client's activity in this other project. Okay, this is a blurb from HUD about client consent, and I put this in here just to drive home that it is HUD's mandate that an HMIS have a system for sharing, especially now when coordination of services, coordinated entry is such a crucial part of how our COC functions in helping clients in a group endeavor type of way. So HUD is saying here, hey, you need to get consent when you're going to share data. If a client declines to consent to share data, you still enter it into HMIS and you have what they're calling administrative steps that are taken to prevent it from being automatically shared. And we have that mechanism where you make a client's record private. HMIS governance. Okay, let's see what we have here. Here's a little Venn diagram so you could see the interconnectedness that HMIS has with all the other entities. So you are working at a participating agency. You're also part of the COC by virtue of being at this participating agency. And our COC is overseeing HMIS, and the vendor is also part of this diagram because we wouldn't have our HMIS without it, right? So I hope that's helpful for you to see. HMIS policies and procedures flowchart. This is how we are connected in a governance way. We've got the HMIS lead agency, which is my office under the umbrella of planning and development. And then we've got partner agencies on the left, that's where you work, and you as an HMIS end user on the right. And so the connections are these two documents between the partner agency and the HMIS lead. We've got the HMIS partner agency agreement. And for you as an HMIS user, we need you to sign every year a user responsibility and code of ethics statement. So there's lots of responsibilities of the HMIS lead. They are listed on the slide, but they are listed and written about in more depth in the policies and procedures manual. So I'm just going to move through here. You can pause this if you want to. More important, partner agencies. Let's learn about them. Partner agencies are all the agencies that enter data into cambridge.clarityhs.com that have a signed partner agency agreement and have also designated an HMIS agency administrator. A network of providers in our COC that share the same goals for our clients and therefore share data via HMIS records in order to, things I've alluded to already, but deduplicate records, improve the ability to coordinate services, enrollment in CCAN, help provide documentation of homelessness, track destinations. Very important to know who we all are because it is our job to inform the clients when we're asking them to consent to share, to let them know who they might be sharing with. So the list of participating agencies is on our website, and you should print them as well if clients need to or want to see them. Okay, partner agency responsibilities also highlighted and described in our policies and procedures. So I'm not going to say too much about it here, but you have these bullets here with some of the responsibilities. Okay, more important is HMIS end user responsibilities. What are your responsibilities? Review and abide by all requirements in the HMIS Policies and Procedures Manual. Be able to articulate how the data you collect is stored and used. Follow the protocol for the privacy process of our HMIS data. Only enter and access data for purposes of delivering and coordinating services. In other words, you should not look at any data or records about clients because you're curious. You should certainly not look at any records about clients for any type of nefarious purposes. You should maintain confidentiality of client data, and you should enter data that you are collecting from clients accurately based on the client self-report and do not misrepresent that information. And you should also report observed security violations. You should report those to your HMIS agency admin, or if you are the HMIS agency admin, you should report them to me. All of this will culminate in you signing this user responsibility statement and code of ethics. It's going to be in Clarity. If you are watching this, but you will not be getting a Clarity license, we will still save it in Clarity, save your signed document within your agency's site. Security reminders. Okay. Only use your own credentials to log in. In other words, never borrow somebody else's account. Never lend your account out. I don't think I need to elaborate on why. Just don't do it. And always log out of Clarity when not using it. Be mindful of your physical space. If there's a clear line of sight to your computer monitor, obtain a privacy screen. We've got agencies that have done that, and it's worked really well. If you need any help getting a privacy screen, let me know. Use complex passwords. Don't write your password down, especially where it could be accessed. You might want to write down a mnemonic device to help you remember your password that is a clue, but isn't literally your password on a piece of paper. Do not communicate PII via email or any other means. Use Clarity unique IDs when corresponding, or internal Clarity messaging, which is very secure. Lock any hard copies of HMIS records in a file cabinet or a locked drawer in an office. This also applies for many of us working from home these days if you have hard copies of things. And do not share HMIS data with organizations outside of partner agencies. Do not share PII. Okay, so speaking of working remotely, our vendor came out with a nice, helpful article about maintaining client data privacy when working from home. So it's linked here. I will link to it elsewhere, and it's probably good for you to read if you are working from home. Okay, moving along. 3 documents pertain to this process. I had a slide that had them listed earlier on when we started, and now we're going to talk about them. The desk sign, I'll call it. Number 2, the ROI. And number 3, the notice of privacy practices. The desk sign. This is kind of a no-brainer. This is the sign that is notifying the people that you provide services to that you collect data for HMIS. And so therefore it must be visibly posted at all intake areas wherever you see clients. So typically this is in an office. Now it could be in a common area. If you run a street outreach project, you should have this hanging up in your van. You can also carry it with you with your other paperwork if you're out in the field. The gist of this sign, it's a general statement about the reasons for data collection, and it references our privacy policy. Hey, if you want more information, it can be found in our privacy policy. And if someone reads that and literally wants to see the privacy policy, you are the person that's going to direct them. You're either going to give them a printed copy or you're going to send them the link to it from our website. So keep that in mind. Also available in other languages on our website. Okay, the actual ROI itself. This is very important. So if you have not yet read our ROI, please pause and read it now. It is pretty much the crux of most of this training. This form was written in plain English about how we may share the information that you're collecting and what a client's rights are. So it's also kind of an ROI and a privacy notice in one, but the wording in here is modified to be more easily understandable and kind of reader friendly. So it's your responsibility to read this and become familiar with it because you're responsible for going through this consent process with new clients. This form is asking the client to give their written permission to share the information you collect with other partner agencies that may end up helping the client as well. This will only be viewed by other end users at partner agencies on a need-to-know basis. You'll also be signing this form as a witness to their consent, or if they refuse to sign the form, you're going to indicate that they refused. You're going to write client refused on the document and sign your name. So either way, you're signing the form as an indicator of your role in the consent process. So this is informed consent and you're the informer. Okay, so next up, our notice of privacy practices. This is more detail than the ROI about why our data is being collected, more detail about the potential uses and disclosures, the types that require their permission and the types that do not require their permission. So logically speaking, we're definitely on the ROI itself covering the types that require their permission, and there's more information on this separate form about the types that do not require their permission. So It also has more specifics about how to submit a grievance. Here's a slide that's telling you a little bit about types, some of the types of uses and disclosures. And these are the ones that more or less do not require the client's written consent. You can read all about them when you read the Notice of Privacy Policy. Okay, let's talk about the three-step process here. Memorize these, make them habitual. They are a part of your workflow. Step one, the desk sign. It's basically just hang up the desk sign. Post it wherever you work with clients. If you are working over the phone with a lot of your clients, then you're going to read this to them, or you can email it to them or send them the link. Step two, check HMIS first, okay? So consent is universal. So we're all the partner agencies. We just need one consent to share in HMIS from the client. So check Clarity first to see if the client already has a consent on file. If you're doing this work, but you're not going to be using Clarity, you won't be able to do this. So you might want to ask your agency admin if they can print you a list on a weekly basis or whenever that would show you who's active in your program that still needs or is missing an updated consent form. And then obtain consent. So enter the ROI documentation into Clarity, show your work. You either received a yes or the client didn't sign, in which case you're still going to sign and upload that form. Okay, let's talk about client rights. Make sure you know about what they are and some special considerations. All right. So, client has a right to give or refuse consent. It's their choice. That's what you're actually going through. That's the process that you're addressing with them when you go through consent. And when they decide not to consent to share, your agency cannot deny them services for that reason. Clients can refuse to answer individual questions. So they can give consent, and then it's perfectly fine if they're uncomfortable or don't want to answer a certain question or questions where they don't have to. Make sure you let them know that if you sense their discomfort. Clients also have the right to access the data that we enter into HMIS about them. So that is detailed more in our policies and procedures. They have the right to revoke consent, and we have a form for this. They have the right to request paper copies of the ROI, the privacy notice, and you should, in your role, be ready to supply those. And they have a right to file a grievance. So very likely your agency has its own grievance policy. The client will go through that method, and then if they still feel that if they're not satisfied with the outcome of that, then there's a formal form from our office, from the HMIS lead office, NCOC, in planning and development that they can access. More on that in our policies and procedures. So let's talk a little bit about consent considerations around competency. So sometimes the question of whether or not a client is capable of consenting on their own behalf comes up. So here is some guidance for that. Clients are presumed competent unless there's a known court order claiming inability to make informed decisions. If there's no court order, but the client does not appear to be able to make decisions on their own behalf, or if they're under the influence of alcohol or drugs, it might be appropriate to delay the consent process and enter their basic information with a locked record. This will, of course, prevent any type of sharing across agencies. But be mindful of getting that ROI later on when they are competent. So if you're working at a wet shelter and you're receiving guests at night and they do not have it all together because they've been drinking, etc., in the morning they might be in the place where they can go through this with you. Does your client have more questions or concerns? If you've gone over the form with them and they're still showing that they're concerned or have questions, take extra time with them. If it's helpful, offer to give them or read with them the notice of privacy practices. Ask your HMIS agency admin if you need help and have questions that you can't answer. And email or call me if you still have unanswered questions. Even in the moment when you're with the client, it's perfectly fine. And it would be wonderful to be able to solve the problem or inform the client right in the moment. Review of key points. Okay, I think that's a good sign. Collecting the ROI is your responsibility when performing intakes. Your work area where you see clients must have a desk sign. You should know the difference between data collection and data sharing. Our consent form is seeking permission to share data across agencies, not permission to collect data. Part of consent workflow includes you signing the ROI yourself to certify that you went through the process with your client. Memorize this privacy process. Number one, make sure you have the desk sign where you meet clients. Number two, make sure you remember to always check Clarity first if you have access to Clarity. Number three, complete the process with new clients who do not already have consent recorded in Clarity. And when you're doing that, make sure that you have hard copies and links to the relevant paperwork and forms, documents, etc., so you can discuss and share these if needed. That's it. Thank you so much for watching. Please let me know if you have any questions. You can call or email.